Hello everyone, my name is Kerryn Burgoyne. I'm coming to you from Melbourne, Victoria, Australia, and I'm going to be sharing my screen as I've got a pre-recorded video here, and this is called Autism and Dental Care, the Challenges and the Strategies. Let me just share my screen. Okay, here we go. 3, 2, 1. Hi there, my name is Kerryn Burgoyne, and I'm the founder, director, CEO of my own business, K-Talk. Today I'm going to be presenting in this video to you of autism and dental care, the challenges and the strategies for autistic people. And this is coming from a lived experience or personal experience, not from an academic perspective. Let's get on with the presentation. So the topics of discussion I'm going to give to you today in this video is an introduction of myself as an autistic individual and where I have come from to where I am now as a self-employed business owner. Dental care for special needs patients. So addressing challenges such as anxiety, gag reflex, and patient comfort during treatment. Innovative approaches in managing dental phobias and special care needs. So finding strategies for finding appropriate care and creating an environment that reduces patient stress. Sharing personal experiences in overcoming barriers to dental care. So I'm going to give you my perspective, my story with dentists then and now, and with them, and what I have to do to get my dental work done in a hospital as an overnight stay. And also sharing some strategies for dentists to work on for working with special needs patients. And then sharing my details so that you can ask me any questions by email. So I was diagnosed at the age of 30 with what was known back then in the late 90s, 1998 to be exact, with Asperger's syndrome. It's now under the same umbrella as autism spectrum disorder by the diagnosis of the DSM-5 that's been done in America. Prior to that, nothing was known back in the 70s, 80s, or even 90s when I was young. So I went round not knowing what I had, and I struggled to understand how I hurt other people. So I could say, for example, to a black person, why are you black? Why are you charcoal? Because I didn't know how to understand racism or accept other people as they were. But the diagnosis also helped me to understand why I behaved the way I did. I felt good and I felt bad. And it took Mum and the psychologist a lot of thinking and understanding why I felt good and bad. I felt good because I had that label that I could now get on with my life, and I felt good because I knew now what I had. But I felt really bad because I'd hurt so many people. And over the time I did my life journey, I did repair some bridges and relationships, but other people didn't want to know about me. So I had to let those relationships go. But the lack of expectations of me wasn't fair. And I was always the problem that nobody wanted to have around or anything to do with the long run. And this could be in social situations such as my family in previous years. So when I was young and I went to the dentist, I didn't realise the implications I was facing at the time. I just went along with everything because I didn't have any ability to understand sensory issues, any lights or any sound or anything like that. So I was just went as a good girl, and I just had my teeth done and checked as what everyone else did normally. But I didn't like the drilling, nor the sprays of the water or anything else. I couldn't comprehend and I was unable to express my emotions to say, stop, I don't like that. When I was 12, 13, I had braces put on and they hurt like crazy. And I knew I had to do this because my teeth were crooked. And Mum was paying a lot of money for them at the time. But I still couldn't say, I don't like this. I don't want them. I didn't have the ability to say, no, I don't want this. My dentist always had a children's Bible storybook, which helped me a lot with my anxieties. This book was comforting to me, even though I was about to get my teeth checked. I read those stories over and over and over again each time I went to that particular dentist. There was something about that book that I wanted to know more about. But that never happened until my late 20s, early 30s, when I became a Christian and invited the Lord Jesus into my life. But still, I never showed any of this anxiety till later on in my lifetime. As time went on, I still went to the dentist for my regular checkups and appointments, till one day it got too much for me to handle anymore, and I needed extra assistance in the chair that I couldn't handle on my own. Now I find that most dentists are still not equipped to handle those with special needs, including those who are more severely disabled or those who are at level 2 or 3 with ASD, autism spectrum disorder. I mean, this could be wrong. This could have changed. I don't know the dentist field. Only you do. But I'm sure dentists are now educated and up to date with people with disabilities, and they work with people with disabilities. But I'm not in that field, so I don't have that knowledge and expertise as what you do. But this is why I'm here today, to explain this to you and to share my lived experiences with you as an individual with this condition, or disability as we call it today. We all have different abilities. We don't like to be called disabled. Yes, I've had some teeth extracted, but learned so that when I had metal or mercury fillings, my body reacted to them so badly that when they were removed, I only started to feel better. That's why now I only ask and request for ceramic ones instead of these metal ones. So, addressing gagging issues. The gag reflex is an involuntary defense mechanism to protect the pharynx and throat from foreign objects. Gagging is a common problem encountered during dental treatment, making therapeutic procedures distressing and often difficult or even impossible to perform. Various interventions can be used to control the gag reflex: anti-nausea medications, sedatives, local and general anesthetic, herbal remedies, behavioural therapies such as CBT, cognitive behavioural therapy, acupressure, or acupuncture. One of the most common ways for dentists to use is to manage the gagging patient is the use of topical or local anesthetics to numb either the tongue, roof of the mouth, or soft palate area, or any of the above. This can be achieved using topical gels and sprays or doing nerve blocks to numb the tongue entirely altogether. So what else can be effective for those with special needs? A patient plan. Develop a patient plan for each one of your patients with special needs so that they are able to cope with their treatment in the chair on the day of their appointment. Social stories. Develop social stories for your patients so that they can take them home and read them if necessary. Always be open to do dummy runs and offer that service for a patient with special needs if they require it. By showing them the tools and how they work, and even have someone in the chair undergoing their treatment, say a nurse as an optional extra, then play the game with them and they have their turn. This may be, in the end, a positive experience for them and you as a dental clinic for when they return for more treatment in the future. Always give them rewards for their hard work. Phrases such as, "You're doing so well. I'm so proud of you. Fantastic. Well done. Let's keep going. Be so positive with your patient with special needs as much as possible, even though you might be fighting with them to get their treatment done at the time. So be positive, persistent, and extremely patient, or very patient. Give them a prize to take home, such as stickers or anything else that you can think of, so that they treasure it or treasure that. Tell them as a prize and make it a kiss scenario. Keep it super simple. If you're good today and we get this treatment done, you'll get this as a great reward. So they'll be able to focus on remember that particular piece of information or that reward, or they can hold the stickers in their hand and they'll cooperate with you and when you do their treatment in the chair. For myself with more severe complex needs such as myself, I'll rephrase that. For those with more severe complex needs such as myself, I need to stay overnight in hospital if I'm given a GA, a general anaesthetic, as I don't wake up for them quite easily as what others do. I tend to sleep 24 hours or more till it's worn off, and then I can go home and recover, which takes me sometimes over a week to do so, as my body is so sensitive to most medications that I've had in the past, including GAs. Dental anxieties. Dental anxiety is fear, anxiety, or stress associated with a dental setting. Being scared to visit the dentist can also result in delaying or avoiding dental treatment. Things like needles, dentals, or drills, or the dental setting in general can trigger extreme dental anxiety. When dental anxiety is severe and causes irrational fear and avoiding going to the dentist, it can be classified as a dental phobia. Most dental disease is lifestyle related and preventable. By avoiding going to the dentist, not only are you more likely to need more complex treatments when you do finally attend, but you are also missing out on learning how to better care for your oral health as a patient. The lifestyle factors that can lead to dental disease includes regularly consuming sugary food and drinks, for example, or alcohol or anything else, or foods. Here's a quote for you. Many anxious dental patients can find a dentist who can support them appropriately to cope with going to the dentist if they're aware of the patient's condition. Severe dental anxiety or phobia may require medical management with relative analgesia, happy gas, anxiety, relieving medication, conscious sedation, maybe twilight sedation, or GA. Not all dentists offer treatment under sedation. Some pre-existing medical conditions or medications may affect the type of sedation your patients can have and may prevent your patients from having some types of sedation. They also could have allergies to these types of medicines as well, so may need alternatives to the usual normal GA that you would use within your clinic. Innovative approaches in managing dental phobias and special care needs. In this slide and video, next slide part of the video, I'm going to be discussing some strategies for finding appropriate care and creating an environment that reduces patient stress. Dental practices can create a stress-free environment by using calming music in the waiting room and treatment rooms and providing clear explanations of procedures to the patient. Now, there is a radio station that you can download from a radio app called SBS Chill. I listen to it all the time and it calms me down. So if I've got a set of headphones on and listening to this music, it can calm me effectively. Use distraction techniques. Dental practices can use a variety of distraction techniques to help patients reduce fear and discomfort, including music. Patients can listen to their favourite music through headphones. TV. Patients can watch a TV show or movie on a ceiling-mounted TV or simulation screen. One of my dentists I used to go to deals with a lot of patients with autism and has TVs on the ceiling for their own patient and comfort care. And quite often the patients usually get through their dental treatment if they're watching a TV or a movie show, a TV show or a movie. How does VR exposure therapy work? As this treatment method is still relatively new in the dental industry, there are no set rules about what's best. But let's take a look at one example of using VR to help people overcome fears. For years, psychiatry has used exposure therapy to deal with fears, phobias, and anxiety. In short, it involves gradually exposing a patient to something they fear, but in a controlled, safe environment. People with social anxiety, for example, are encouraged to gradually do more activities in public. VR in dentistry is much the same thing, except without any physical pain elements. The patient wears a pair of virtual reality goggles that allows them to experience simulations of common dental procedures. These videos include everything from the sound of the dentist drill to the dentist's hand approaching your mouth. Following exposure to these situations that can make people anxious, they can learn to deal with their fears more effectively. So when it comes time for the real treatment, they then have a clear understanding that there's really nothing to fear at all. Use a signal to stop. Patients can agree with their dentist on a signal to have a break or stop the procedure altogether by putting up their hand. Sometimes I will say to my dentist, "Stop, I just need a break." And I constantly swallow because my mouth is small. Use gradual exposure. Patients can start with non-invasive procedures to build confidence and reduce apprehension. In special needs dentists, using sensory toys for those who wish to hold something whilst undergoing their treatment in the chair. This can help enormously with heightened anxiety, whilst also trying to cope with a multiple of dental drills as well as mirrors, etc. in their mouths. So here in Melbourne, we have the Royal Dental Hospital, which is a public dental hospital. And you can bring in your own sensory toys to hold. And they have a lot of people with disabilities who have dental treatment there. Sharing personal stories and strategies for dentists to use in their own practices. Arrange with the patient to have a tour of the dental clinic itself, if it's possible with them, and their parents to allow the patient to look at all the various tools, etc., without touching them. But while underneath the treatment of the dentist, ask the dentist to put the drill on their hands or any other tool if they can do this, so then they can feel what it's like before going in their mouth. Try to make your dentist smell nice if you can do so, instead of it being sterile as it normally is. Do this over and over again so that the person with ASD, autism, is comfortable with the settings. Each person will react differently to the clinic settings, of course, and some may not even be able to tolerate the smells due to heightened sensory issues. Going to a special needs dentist is the only way for those with abilities to get their oral health looked at, if dental clinics don't have the capacity to look at their oral health in a regular clinic. There are not many around here in Australia. I could be again wrong, and the costs outweigh the process of attending one here, as they're so very expensive to pay for the fillings that you need and for the general anaesthetic, as well as the hospital stay. So my story was I went to a dentist in another suburb, and the woman found 10 fillings that required me to have $3,580 worth, being on a pension, a very, very low income of only $900 or $1,100 a fortnight. And then the anaesthetist fees were $5,000, plus an additional $220 an hour for him to look after me until 6 o'clock. And then I went to the Royal Dental Hospital, and then I was told I only needed 5 fillings. But because now I require that overnight dental setting, overnight hospital stay, I've got private health insurance, but even my private health insurance wouldn't cover this. It was $110 per filling. It was $600. It'd still be $2,500 out of pocket. So I just said no. I just moved on to the next dentist, which is a public one. Over here in Australia, and in my own experience, most dentist clinics do day surgery in hospitals and with patients with special needs, but none do overnight care is what I need to have. So I'm classified as an extremely complex patient. But they're all on the other side of town, which is very inconvenient for me, so I don't have any family members that will drive me over there. And I still have to find a way over there and back again. But luckily for me, I've got friends to rely upon should I require transport anywhere that needs to be done in and around Melbourne and sometimes into regional Victoria. So this says a thousand words. People will have positive experiences, will keep on coming back to your clinic if they have positive experiences. Have a think about that for a minute. So again, create social stories and other resources for your clinic. So have these social stories handy for patients who come into the clinic. And your staff should be well trained and up to date with disability training when dealing with special needs patients. I'm also able to help you if you require that training for people with autism spectrum disorder. So this is my story. I've just explained it. I found a dentist who deals with patients with special needs. However, she charged like a wounded bull, as they say. Fees and charges were very expensive. This was another one to pay at $5,000 AUD. And that's a lot of money if you're on a very, very limited income. I couldn't even afford to pay off a payment plan that they'd offered me at the time also. This was way back in 2016, I think. 2017 maybe. The one I found in a suburb here in Bundoora, as I mentioned earlier, also dealt with patients with special needs, and he was very low cost, so I went with him for a while. However, the hospitals here in Melbourne saw that there were more urgent cases of people requiring surgery in other areas, such as heart, liver, kidneys, and lungs, as urgent cases. So once again, people with disabilities were shunned out of the system, made it as an exceptional lower priority. Therefore, it was the end of all public hospitals or private hospitals dealing with their dental care. So in the last 6 years, I went to a dentist who did my treatment under a GA. That was the one in Bundoora, and I felt that it was by far the best way of having my fillings done, as well as a general clean. So having gone back to a public dental system, they have used laughing or happy gas on me, which has now made me feel relaxed to get my teeth cleaned under the procedure. That has been fine, but as I'm highly sensitive to all drilled noises and people's fingers in my mouth, I prefer not to tolerate in the chair while I'm awake. I've also got the very small mouth of a child, as well as sinus passages, as I was born this way with that. So opening my mouth as wide as it can go is extremely difficult for me to do so, and having the constant swallow of my airways blocking up. So it's far better for me to do it right under a GA and have all my dental work done, including x-rays as well at the same time, whilst I'm out to it sleeping blissfully while all this is going on around me. The public system has gone downhill and the government doesn't care about it. There are more higher priority projects such as the building of roads, rail networks, which I can understand as many people use them. However, those with disabilities are once again hidden or ashamed of behind a 100-foot brick wall to be not dealt with. As they're too hard to deal with, they put them in the too hard basket. But how would you feel in this situation if you were a person with a disability and you couldn't get your dental work done? Our public health system is failing and needs urgent attention. We now have a major dependency on public hospitals for care, up 20% in the 5 years before COVID-19. There is a failure of emergency departments to cope with the demand and ambulance ramping, medical staff burnout, working longer hours, and the demand for doctors and nurses are not there. Telemedicine in place of closed outpatient services, long delays for medical inpatient beds, prolonged elective surgery waiting lists, deterioration in hotel services and caps on activity. The list goes on. In my opinion, people with disabilities should be given first priority when it comes to their dental care. So here are my contact details. Please email me your questions, and I look forward to receiving them as soon as possible. And that's the end of my presentation. Thank you very much for listening. I hope to hear from you soon.